to demonstrate your enhanced level of expertise in this field, we now have a board of anti-aging medicine and regenerative medicine. The Academy also has a fellowship program. Between the board and the fellowship program, there are over 2,000 physicians enrolled worldwide in both the board certification and the fellowship training programs. And so this is growing very aggressively and very wildly because, because it works, number one. And number two, physicians like this form of medicine. They like to be able to show immediate results for their patient. They like to be able to prove to their patient that what they have is of value and an impact on the lives of their patients. And they like to look for cures. They like to look for the prevention of disease and the cure for disease, and that's really what anti-aging regenerative medicine is all about. It's not about illness care. It's about preventive medicine. It's about curing disease and about preventing disease before it occurs. And we also have the American Board of Anti-Aging Health Professionals for health professionals who are other than fully licensed physicians, other than MDs and DOs. So we have quite a few PhDs and pharmacists, some chiropractors, some nurse practitioners who are a member of that. So we're an all-inclusive organization that's all over the world. And we like it that way. We want to be inclusive. We don't want to be an old boys club. We don't want to be a closed shop. We have a message that's for everyone because ultimately we're all dying of the same horrible, miserable, awful disease, and that's called aging. It's 100% fatal. No one's ever survived. And it doesn't look like anyone's going to beat it anytime soon. Even Methuselah only made it to 969 years. Now, one of the nicest things that's been said about me is Business Week. They said some rather unnice things. I'm sure those of you who have followed the field have seen the critics of anti-aging medicine and how critical establishment medicine has been towards the concept of preventive medicine. It's kind of crazy to me. I didn't believe it when I got started with this, that anyone would have a problem with living a longer, healthier, happier, more productive lifespan. But surprise, surprise, the old line establishment, especially gerontology establishment, does. But despite that, the public is speaking, and they're speaking in the loudest voice they have, which is with their wallet. And so when we got started with anti-aging medicine, it didn't exist as a financial category in 1992, but today it's over $60 billion in total revenue. Now that takes in everything of anti-aging medicine. Anti-aging medicine is, after all, a very large umbrella that takes in plastic surgery and drug therapies and laboratory testing and the spa industry, but $60 billion is still a hefty hunk of change, and at an annual growth rate of 9.5% a year, this is a very affluent new medical specialty, and doctors are earning quite a good living at it. But that's not why we're doing it. We're doing it because it works. We're doing it because we're trying to save our own lives. That's about, that's the bottom line is, you want to save your own life. If you can't save yourself, how can you save your patients? And we want to save our patients' lives. We want to extend those healthy, productive, vital years. We want to give people the longest possible health span we can provide for them. And that's really what anti-aging medicine is all about. Anti-aging medicine is, after all, any technology that has to do with the early detection, prevention, treatment, and/or reversal of aging-related disease. And I can say that with quite a good deal of authority because I'm the guy who coined the term. So anti-aging medicine is really the pinnacle of healthcare. Now, again, quite to my surprise, the gerontological establishment didn't really like what we were doing, and funded actually a disinformation campaign to the media around the world, claiming that the research, and this was published in Science in 1990, the biodemographers claimed that they had concluded after extensive research and looking at the claims of anti-aging medicine that the practical upper limit to life expectancy is 85 years. This was published in Science magazine in 2001. Actually, it was published they were told about this in 1990, but it was again published in 2001. And also they went on to say that regardless of how many lifestyle improvements we make, vitamins we ingest or hormones we inject, the chances of life expectancy at birth rising to 100 years or beyond is slim to nil. And that's quite interesting because there are some people who are suggesting that, that girls born in Japan today are looking at a life expectancy of 95 years of age. And so I think we're coming very close to putting kibosh on that infamous quote as well. And then another very interesting quote from the gerontologist is, the biomedical knowledge required to modify the process of aging that leads to age-associated pathologies does not currently exist. Yeah, that's my favorite. Okay, and I bring these. I emphasize this because there's a doctor in the audience who came to me yesterday, and she said, you know, Dr. Klatz, I really love this stuff. You know, I believe in it. I practice it myself and my patients. I get very good results with anti-aging medicine. But I'm from a country, and I won't mention what country she's from, and I want to bring it to the other doctors in my country, but they're so conservative. They don't want to really look at new things, and I'm afraid that I might be ostracized or castigated. I might be criticized unfairly for suggesting this anti-aging. How do I get past that? Well, I have the answer to that lady, and it's right here at the bottom. In the recent issue of The Scientist, okay, a very prestigious publication, in the United States, the gerontologists, the very same people who were poo-pooing anti-aging medicine not too very long ago, are now saying quite the opposite. So I guess we won. Now they're saying that genetic and dietary interventions can retard nearly all late life diseases. The belief that aging is an immutable process programmed by evolution is now known to be wrong. And the reason why they're saying this now, which I find extremely humorous, is because the NIH, which funds, National Institute of Health, which funds $28 billion in 2006 in research, but less than 0.1% of that amount goes to understand the biology of aging or how it predisposes us to a suite of costly diseases and disorders expressed in later ages. They are calling on Congress now to invest $3 billion annually to explore aging-related disorders, aging-related illness, anti-aging medicine. So I guess if there's enough money on the table, our friends in gerontology will come around. And so they have. Only they can't bring themselves to call it anti-aging medicine. Now they call it, all kinds of other euphemisms such as healthy aging, happy aging, successful aging, et cetera, et cetera. For example, the American Association of Retired People spent $100 million in the year 2000 trying to induce or entice the baby boomers to join their society, because the baby boomers simply don't think of themselves as being candidates for retirement, so they weren't joining the AARP. So in order to pique the interest of the boomers, they found this lady, a 55-year-old salsa dancer here, thinking that she might be a very attractive role model for aging. And here we have this 55-year-old woman with bunions and osteoarthritis of the knees, it appears, and a middle-aged spread. And so she's the AARP's poster child for what they might call healthy or successful aging. In the center, we have the gerontologist's vision of what successful aging may be. This is from the NIH's own website, the gerontologist's own website. And this is a 68-year-old man in a nursing home receiving hyperalimentation through an IV. Okay, so I guess that's successful aging to some people, not to me, of course, or hopefully to any of you. But the A4M's model of anti-aging is Bob Del Monteque, Dr. Del Monteque, and Kelly Nelson, who in this photo was, he was 82 and Kelly Nelson was 79. Okay, so that's our vision of what successful, healthy, happy aging might be, or anti-aging medicine. But we don't have to look to, to freaks such as Bob Del Monteque and Kelly Nelson, real outliers. Okay, I use the term freak in the kindest, most gentlest form. I hope to be that freakish at their age as well. But we need to look, all we have to do is look to Hollywood, because we have Mick Jagger, who's 65, who's still running around like a madman on stage. He does 2 hours of aerobics, full performances without any problem. We have Goldie Hawn, who is 65 this year, still a model of an attractive woman. We have